universal coverage is the need of our times. We are one of the few industrialized countries that does not provide health care to its people. And once you solve the health insurance issues, then the providers will try to move into those communities where they are not now. They're not there now because if 1/4 of African American are uninsured, 1/3 of Hispanic are not uninsured, why would somebody open the office in those communities when they know that every third person coming in would not have the ability to pay?
The AMA is absolutely committed to making sure that the 47 million Americans who have no health insurance get access to that health insurance. We know that people who don't have health insurance live sicker and they die sooner. They delay preventive care, they delay treatment because of concerns about being able to afford it. And this is a tragedy. It's not just a statistic, it's 1 in 7 of us, and the AMA is committed to making sure that that changes.
The nation should commit to a proposition that all individuals in our country ought to have health care coverage. We've proposed a strategy to do that. Other organizations have adopted strategies to do it. Many of us have worked together to promote strategies. So I think we're on the cusp of a tipping point for the nation, actually, to get very serious about finally solving this problem.
Here we have the richest country in the history of the planet, and yet we've got 47 million Americans who are uninsured. That's more than the aggregate population of almost half the states in the United States, the least populous states, of course. And so it's extraordinary to think that in the United States, where the costs of health care are far higher than any other country in the world, and yet we have such a large proportion of our population who can't gain access to coverage. I think it's a matter of conscience that we actually are a magnet for people who are wealthy in other countries to come here to get high quality care, and yet people in this country can't get basic care. And that's something I think we need to get changed very quickly.
I think we'd have to say that the #1 issue is lack of quality health insurance. 47 million people don't have any insurance at all, and millions more are underinsured. So we had a campaign that we did with AARP and other organizations like the Heart Association and Diabetes and Alzheimer's saying, are you covered? Are you sure? Because many, many people who have health insurance get a diagnosis of cancer and find out it's not adequate. So clearly, the lack of access and the lack of proper coverage would be the 2 biggest problems cancer patients face today.
We need consistency, and we do not have that now. For example, in the Medicaid program, which the Kaiser Family Foundation has worked exceedingly hard in trying to address and to improve, in the Medicaid area, there are these categorical eligibility restrictions. Nobody understands them throughout the country. We ought to replace that with an income standard. So pure and simple, in our view, anyone under 100% of federal poverty should have Medicaid eligibility. That plus S-CHIP at 250% to make sure that we are repairing the safety net and having the kind of public program foundation that we need as a nation. This leads right into our second proposal, which is to have refundable tax credits for working families so that from 100% to 400% of poverty on a sliding scale going up to $80,000, providing a helping hand for working families to be able to afford health care coverage.
But there are certain things in the health system that create disparities. For example, 1/3 of Hispanic are uninsured. They don't have access to care. 1/4 of African Americans are uninsured. It's not only the uninsurance that we are concerned about, but also those who do have insurance. They may be covered by Medicaid, they may have a private insurance. There's no provider in their community. And so we have islands within our nation where there's no healthcare provider or very limited healthcare provider. As a result, the minorities can't have access to care, so they seek care late. And by the time they seek care, they're very sick, and their outcome is not very good, and it costs a heck of a lot to the nation.
The good news is for people who can afford it and have access to the best that our country can offer, the prospects of surviving cancer have never been greater than they are today. So that's the good news. More and more people are surviving. The bad news is more and more people are getting sicker, suffering more, and more likely to die simply because of lack of access to quality cancer care. And so The American Cancer Society has gone on record to saying that lack of access has become a major cancer killer in America. The number's big, and it's getting bigger.
We really have a healthcare sector, not a healthcare system. Not everyone's covered. Doctors, hospitals can't talk to each other. We don't have any real way to put value on healthcare. So we need a system that has everyone in and has some protocols and way to do this work a lot better than it's being done today.